to Ask the Expert. You may have noticed there's a big focus on women's health issues during January.
That's because it's Cervical Health Awareness Month.
So we have Dr. Rashmi Kaul with the OBGYN Department of Aurora Health, and she joins us now live this afternoon. What is, first of all, cervical cancer?
Well, cervical cancer is cancer of the cervix. It's usually 99% of the time caused by persistent HPV infection of the cervix.
So what is the best way for women to protect themselves from cervical cancer?
Number one is avoid having unprotected intercourse. And then HPV vaccines, there's 2 of them, Gardasil and Gardasil 9.
What are you telling your patients about those shots?
Those vaccines?
So most women should get the vaccine starting at the age of 11. 11 to 26 is when it's approved for. You want to get the vaccine on board before women start having sexual intercourse. Also, boys are encouraged to get the vaccine as well.
And for women who, when this vaccine came out, were probably, I know I was older than 26 when
Absolutely.
it came out. So again, is there anything other than you saying unprotected sex not to have, but that we can do that would just be another reassurance that cervical cancer is not something that we will see? Cervical
cancer screening. So we're really lucky to be able to have cervical cancer screening in the U.S., where the rest of the world doesn't have screening guidelines.
And so for patients who are coming in, how often do you talk to them about this? Is it this is at the yearly review or just regular visits, or how?
So most patients should start seeing a gynecologist when they become sexually active. Cervical cancer screening, the American College of Obstetrics and Gynecology says that we should start screening at the age of 21 every 3 years if they're normal, and then starting at age 30 you can space it out to every 5 years.
So is a screening different than a pap smear?
So cervical cancer screening and pap smears are the same thing.
Oh, okay. All right.
So what is the concern about the symptoms of cervical cancer? Will someone know?
In the early stages, most people don't know. As we get to the further stages, vaginal bleeding is the #1 cause or symptom.
Is that a scary thing? Because most women, vaginal bleeding, you would think, okay, this is my menstrual.
Right. So they're going to have vaginal bleeding that is associated with intercourse or unscheduled vaginal bleeding.
What are you finding with your patients, or just in general, what you read about this subject? How aware are women about this issue? We hear so much about, you know, breast cancer, breast cancer, breast cancer, but what about cervical cancer?
I think a lot of women are not aware of it as much as we'd like to think. So a lot of my patients, the first time I see them, they're like, yes, I had a pap smear done in the emergency room.
Oh.
Most women do not every time you have a speculum exam does not mean you're having a pap smear done. So I don't think most women know what a pap smear is. They don't understand that it is a screening test for cervical cancer.
Okay, so you just really want to educate women to get that yearly exam, ask questions. If there's something abnormal, go see your doctor.
Absolutely.
All right.
Dr. Kaul, thank you.
Thank you so much.
Well, if you have a question for our experts, you can simply email them at asktheexpert@tmj4.com, or you can even leave a voice message at 414-967-5253.
Well,